glad that you decided to come back for another session. And today we're going to be talking about one of the biggest diseases that I know of that are dick killers. Yes, erectile dysfunction on a massive scale, also a lot of other things that go on psychologically when you have different diseases, especially when you hear the word incurable. I believe that a majority of the type 2 diabetes is curable. The issue is whether or not the patient truly wants to be cured, and we're going to go into that later on. And by the way, I do want you to be wealthy. You know, I read all the time about men who have erectile dysfunction and have type 2 diabetes. Now, this brings a big burden on my heart, and the reason why is that I know that through lifestyle changes, a lot of these individuals can overcome that. And I'm excited by that. And when we understand that it's not a body problem, it's a lifestyle problem, then we can make that transition. Now, I understand that weight loss is very difficult for some people, and I understand that it is not their fault. On the other hand, those individuals that eat a high amount of fast food, fatty food, fried foods, look, you can't do that. You've got to get rid of that out of your diet. Now, I'm not going to go into anything about type 2 diabetes because I'm sure that if you're watching this video, you already know what type 2 diabetes actually does. But a quick analysis of that is that it lies in the insulin uptake and also the insulin production, and it's low. Now, the latest in monitoring diabetes is those patches, those magnetically wired receptors and sensors that tell you what your blood is. I think is an absolute dream. I really like that. The issue is that, do you truly want to have a quality of life? Those of you that are watching this that do have type 2 diabetes, do you really want a quality of life? Or have you resigned yourself to having different body parts and being cut off and going blind and having heart disease and strokes? Now, there is one therapy that I have heard of that talks about changing the way that you eat. This particular program does a outreach, and they do it over a week period of time. They immediately have been able to get people off of insulin by the end of the week, and I love that. I just think that's absolutely incredible. I am also very cognizant of the fact that different therapies that deal with nutrition, eating habits, Reiki healing, Kabbalah healing are also extremely effective because of the psychological part, which we're going to go into in just a minute. All right, so what does the diabetes do? It shuts down the major parts, major organs. That's your heart, that's your blood vessels, that's your nerves, that's your eyes, it's your kidneys, it's your skin. Now, we've all heard about diabetes and stroke and vascular and heart disease. Yeah, there's also nerve damage to the limbs. And then there's nerve damage to your gut that causes nausea or vomiting or diarrhea. And what we need to do is not have erectile dysfunction, because there's the nerve aspect of it, but there's also the blood flow. And there's kidney disease that's caused by diabetes, eye damage, as I mentioned earlier. Also, you get skin conditions, fungus, bacteria, eczema. It's not good. And because of the slow blood going to the surface, you also have a long period of time for healing, internally and externally. You also have hearing impairment, and then it leads to dementia. So there's a lot of really nasty things that are going on with this disease. So, what do we need to do? First off, start eating healthy. Eat in moderation. Get rid of the fatty foods, as I mentioned earlier. Next is to become active. What does that mean? That means you have to have 150 minutes per week of moving around, vigorous aerobic activity. You can either go for a walk, bicycle, running, swimming, walking on the beach, anything that deals with movement. And that's just going to help stabilize the muscles. It's going to get rid of the fat that's clogging and pushing on some of the veins, and it's going to go really well. If we lose just 7 to 10% of our body weight, it immediately just opens up a lot of the blood flow, and it prevents going into diabetes. And that to me is absolutely fabulous. We need to be active. We need to just get up, move around, put the TV away, put the books away, find a hobby where you're standing, where you're moving, where you're going places, not necessarily just driving, but you're going places. All right, so let's talk just a little bit about some of the psychological aspects of diabetes. First off, they have said that it's hereditary. Now, I have a hard time with that, and the reason why is it's role models. If we learn that a certain body type from our parents and our role models is appropriate, then guess what? We feel that we can do it and still have the same lifestyle. Reality is that I'm sure that those individuals that were your role models didn't have a very active lifestyle or were happy in their lifestyle. So let's just go down the list of some of the psychological reasons why people have diabetes. And you can get therapy through psychiatrist, psychotherapist, pastoral, Reiki healing, Kabbalah healing, any one of those. The whole point of it is that you need to do it for yourself with another person, and because it hasn't worked in the past. And there has to be action behind it. So let's just talk about it. You have to want the change. You have to desire down deep in your heart that you want to have a healthier lifestyle. You want to live longer. You want to be with your family. You want to make a mark in the world. Any of that will do. And understand that the diabetes is caused by a severe state of being sorry. Sorry for this, sorry for that. Sorrow is a huge part of it. And think about this, that as life progresses, there's no sweetness in life. The sweetness and the taste and the vitality is all gone. It is over the top. Desire for control. We are insulating ourselves. Our body is acting like an insulation device against our own personal traumas and life traumas. And when we psychologically realize that we need to make those changes in our mind, and cognitive therapy is a wonderful way to go. Point of, we need to make the change if we're going to get better and healthier. If we make the decision that we're going to go on this 2-week diet, guess what? It's not going to work. We've talked in the past about how long it takes to make a habit. 90 days is how you actually change a behavior. You can change a mindset much quicker, but actually changing the behavior and getting on board is much more difficult. Well, I do appreciate you coming. I appreciate you listening. I look forward to you contacting me and making a comment down below. Oh, I forgot one other thing, that if we are talking about erectile dysfunction, diabetes is one of the worst ones, and it's on the road to where you're going to start taking a needle and injecting it into your penis, and then that's going to cause a number of other different complications, especially if the needle isn't taken care of or aseptic technique is not being used. And then the last thing is that a lot of men with diabetes happen to have implants. Now, I don't have an implant. I don't talk to very many people that have implants, so I can't give you much information on that. My point is that it's extreme. Diabetes will cause you to go to an extreme. If you're serious about your life, if you're serious and you have joy in your life and sweetness in your life, and there's very little disappointment and sorrow, then you have a great opportunity to make a difference in your own life by making the change in order to become more healthy. Go ahead and make your comments. I'd love to hear from you. Go ahead and call me. I'm sure that we can get together and get some issues resolved so that you can get off of any of the medications and be able to perform in the bedroom just like the old days. Thank you. You have a great day.